Well, the doctor is in with a revolutionary technique that might be their newest tool in the fight against cancer. It's a gene editing treatment that apparently changes the genetic makeup of cells, transforming them into cancer-fighting weapons.
I remember sitting watching the nightly news and, looking at my husband and saying, wow, this is going to be huge. Not knowing then a year later we'd be actually involved in it and using it.
My name is Austin, and I have leukemia.
My name is Kim, and my son Austin was diagnosed with acute lymphoblastic leukemia. We were getting ready for his 3rd birthday. We were looking to, expand our family. We had all these plans, and then all of a sudden we were blindsided.
My diagnosis was made in the fall of 2009. I was checking myself around my neck and found some bumps. I did have a routine appointment coming up later that year and mentioned it to my physician, who said, well, maybe you have a problem and maybe you don't. And a few weeks later was confirmed that I had atypical chronic lymphocytic leukemia and small cell lymphocytic lymphoma.
Austin was almost 3 years old when we found out that he had cancer. They took us into a room, my husband and I, and that was the first time that we had heard that we think that your son has leukemia. I just remember I went numb. I went blank.
I was put on a wait and watch protocol, although I refer to it as wait and worry. And about a year and a half later, I did have 6 months of chemotherapy, which did resolve the problem and put me into remission, which lasted about 11 months. And then my blood counts showed a reemergence of the leukemia cells.
Our world just stopped, and we had to plan. You're hit with so many different things, and all these things, like these thoughts, and come rushing in your head, and it's like, I don't know what to do first. So everything started and happened very quickly because of his high-risk diagnosis of his leukemia. He was to be on a 3.5-year program. We went in for a normal routine blood test and a checkup, looking and feeling great. You wouldn't be able to tell at all that anything was going on, and they had to tell us his leukemia was back. It's almost worse being told the second time that your kid has cancer, when we thought that we were on a good path and we were hoping just to finish out the 3.5 years and move on. At that point, because he relapsed while he was still on chemotherapy, our only option at that point was for him to have a bone marrow transplant. So we had to rely on a stranger to help save his life. And there's lots of complications that can arise, obviously, with transplant. He did a bone marrow biopsy. Their protocol is every 2 months. They do bone marrow biopsies after transplant, just to make sure everything's looking good and clean. And it was a Saturday, and I was home with him. My husband had come home from work. He had gotten a call from our physician, from Austin's doctor, and had the results of his bone marrow biopsy. And he had come down the stairs. He was crying, and he basically got out that we had gotten the news that his cancer was back again. And by this time, our situation had gone from, bad to really bad, and now our situation, this was grave.
I was started on a clinical trial, which again worked for about 3 months, and then my lymph nodes re-emerged on my neck, and 3 months after that, I was politely discharged from the trial as being a failure. And at that point, we didn't exactly know what we were going to do, and we had 2 suggestions. One was to seek out what would be the next therapy option as a clinical trial of CAR T therapy, and we were referred to Sloan Kettering for that. And the second option was to start on 2 medications which had not been used in combination before, And the good news is the combination of medicines did really work and was very effective, and my lymph node shrunk down, my blood counts turned to normal. Having said that, we know that I'm in the group that will keep tripping into trouble. And so we did travel from our home in California to Sloan Kettering in New York to have the first stage of the CAR T therapy.
I first met Austin when he was 5 years old. He, at that time, at a young age, had already been dealing with leukemia for a while, for much of his young life. He was diagnosed at a young age with a type of leukemia that is often very curable, but he had a particular type that is higher risk for relapse. He relapsed very early after bone marrow transplant, which is extremely high risk for a patient in that situation. There are often really no options for other therapies, especially when you relapse that early after bone marrow transplant.
CAR T-cell therapy is a type of immunotherapy where we take patients' own T-cells. So T-cells are part of our natural immune system that all of us carry, that we fortify them to express a chimeric antigen receptor, which is abbreviated as CAR. It's an artificial T-cell receptor that's genetically engineered to target a specific tumor antigen or tumor marker.
It's chimeric because it has two parts to it. So there is the part that is expressed on the outside of the T-cell. This is usually an antibody, which helps recognize a target on the surface of the tumor. When this antibody recognizes the target on the tumor, it provides an activation signal through its signaling part, which is inside the cell in these T cells.
What we do is we take a particular part of the immune system, a T cell, which is very good at killing cells in the body that shouldn't be there. But they are not able to recognize the cancer cells until we change them in a way so that they can recognize the cancer cells. We take those T cells and we reprogram them or engineer them and make them recognize something on the cancer cell. So what happens is after we have manufactured the T cells and we're able to give them back to the patient, they're then infused in the patient and they're able to go everywhere in the body and find the cancer cell, and they can stick to that cancer cell and kill it. And they then can multiply many times over and continue to go all throughout the body, potentially last for many months or even years. And so the hope is that they're able to continue to live in the body and be able to hunt down if there's any remaining blood cancer cells that they can then kill off later on.
We're very lucky that Austin's physician is part of a research dream team and knew a lot about the clinical trials being offered around the country.
So CAR T-cells are currently is a very promising therapy and used in a variety of different cancers. They started as targeting leukemia cells first, but because you can engineer the T-cells to target any specific tumor antigens, so they are being now studied in clinical trial settings for many of different solid tumors, as well as a variety of different lymphoma patients as well.
This treatment provides a lot of hope for patients who have been through a lot of other therapies and in many cases have lost hope because they haven't responded to those therapies. And we have seen that many patients who have been through this treatment after not responding to many therapies before have responded to this, and in some cases have stayed in remission for many months, for years, and many are still in remission. And so it does provide a lot of hope for patients who may be appropriate for this therapy.
We had to travel to Pennsylvania and meet the team here. They had to check him out and make sure that he qualified. From there, we signed consents, and basically we're told that this is still a phase 1 clinical trial, that not many kids have been treated, and that they made it clear that this is not necessarily a cure. But at that point, we were out of options, and this was our only option in order to try and save his life.
The CAR T-cell therapy, the involvement in terms of the patient perspective, what it actually takes to get this therapy put into reality, it involves the very first step is this is still part of the experimental therapy, so you have to be eligible for clinical trials. Once you're deemed eligible for a particular study, and then we will take your own T cells during what's called leukapheresis, or also called apheresis process. That is very similar process as if you're donating blood. So you're hooked up to the apheresis machine, where it's going to take your white blood cells. Process will take about 2 to 4 hours at a time, depending on a variety of different conditions. Now, once we collect those T cells, the white blood cells, we take those products into a clinical manufacturing facility where we are going to genetically engineer them and produce the T cells. So that the whole process can also vary in terms of the timing, but typically it's on average about 10 to 14 days of a cell production time. Once they are made, we typically freeze these T cells so that whenever the patients are ready, and then your treating doctor decides it's a good timing to treat you with the CAR T cells, and then you will be either admitted to the hospital or come to the clinic to receive these CAR T cells at that time.
Much like transplant, it's a quick infusion, push into his port, and we just waited for what they told us would be a storm. They call it the storm, and basically waiting for him to have these side effects and get sick. And at that point, we would go into the hospital, and they would monitor him, because the kids can get pretty sick when they get these T cells.
This CAR T-cell therapy appears to be very effective. It can cause very dangerous side effects. There are two major side effects that can develop with CAR T-cell therapy. So there is the cytokine release syndrome, which is a condition where the T cells, once they start reacting against the tumor cells, they produce multiple different cytokines in the body. And these cytokines can cause an inflammatory state in the body.
What we can see is something similar to a patient fighting a serious infection. And the way I often describe it is that it is similar to a bad case of the flu. We can see high fevers, we can see that patients have significant body aches and pains, and then in some cases they can have more severe side effects that in some cases can be dangerous. And in those cases, we use medicines to try to blunt and block those side effects.
The second major toxicity that can happen after CAR T-cell infusion is neurotoxicity. These patients can become confused, disoriented. They can feel very sleepy, sometimes may develop tremors or even seizures. Occasionally, patients can also have swelling of the brain. Some of these side effects can be life-threatening.
These could happen usually for the first 2 weeks of the CAR T-cell therapy. These are transient and reversible side effects, and there are medications that we are actively studying to reverse this process, to mitigate these side effects as well. But these are some of the side effects that we educate our patients and caregivers during this process, because patients themselves may not recognize that they are going through these side effects. They may be too sick to recognize them sometimes, but caregivers, it's important that for us to really educate them that what could potentially happen. So when these side effects occur, they're not too alarmed by it and they anticipate this could happen. It's our job to also help them walk through the process and not to be too anxious.
It was about 6 days later, then he just started not feeling himself, not, as energetic. He was more tired, and the main thing that brought us into the hospital, he had low-grade fevers, and he had excruciating headaches that required IV pain medicine, because he was miserable with the headaches. But we were kind of thinking that was a good sign, because he did actually have leukemia in his brain. So we thought that hopefully was a good sign that the T cells were then attacking the leukemia where it was in his brain.
What we are working now is to eliminate the side effects or minimize the side effects of these patients. At this time, while we do observe the side effects such as cytokine release syndrome and neurological side effects from the CAR T cells, we actually do not know whether patients need to go through or experience all degrees of these side effects for these CAR T cells to be effective. So what we're working is to mitigate these side effects, to understand why they're occurring, what the mechanism is, so that we can better anticipate and prevent from these side effects from occurring, and while not compromising the efficacy or the clinical activity of these CAR T cells.
He had his bone marrow biopsy, and we were waiting for those results, and it ended up being on Halloween, which happens to be my birthday. And we had taken him out in his Ghostbuster costume, and we were trick-or-treating around a suburb of Philadelphia. And while we were out, I got the phone call from the doctor, and that was when she said, "It worked. He has no more cancer left." And I just started crying, and, I was wanting to shout to everybody that, he's cancer-free. He doesn't have cancer anymore. And, he was more concerned about getting candy and being a kid. And that's all we've ever wanted, is just for him to be a normal kid.
Immunotherapy has been tested in patients with lymphoma for now almost 25 years. But this is the first time that we are seeing patients develop extremely good responses with immunotherapy and very durable responses with immunotherapy. Most patients that fail standard chemotherapy or radiation therapy, we typically refer these patients to hospice care because of lack of any other options. But with this CAR T-cell therapy, we are finding that these patients now can go on to develop very productive lives.
When someone gets a diagnosis of leukemia, I don't care whether you're a physician, an expert, or just a regular patient. It's a traumatic, tragic event. And even being told that I had a 50-50 chance of not requiring therapy, in my mind, of course, I'm thinking the worst case scenarios. And unfortunately, that came to be true.
Curing cancer is great, it's a lofty goal, but even better one will be to prevent cancer. Currently, there's really no therapy that's out there that's known to prevent a blood cancer. We're continuing to work on to find out what causes blood cancers to begin with, to identify the cause of the blood cancer, which will then help us to find a prevention for such blood cancers too. There's no current therapy out there for those, and we are continuing to work to find the cause. And once we do, hopefully we can even achieve that, really the holy grail of preventing a blood cancer.
We're very thankful, obviously, that we've been able to be in this trial, and that he's done as well as he has. I refer to it as he's a miracle. He's absolutely 100% a miracle. And, we're very thankful that we have days like, today, or, being able to travel and being able to celebrate birthdays and holidays. And, those things mean so much more now than they did prior to cancer entering our lives.
The best part of my job is seeing a child who has been through so much come back for a follow-up visit with me and be back in school, be playing baseball, and be so active and joyful. It's too early to know if this will be a cure for many patients or some patients. However, we are hopeful because there are many patients who remain in remission for several years after receiving this therapy, raising the hope and the possibility that this may potentially be a cure for some patients.